Hey guys, Vicky Nguyen here with NBC News, and I'm with Dr. John Torres. We're going to have a conversation right now and take your Facebook questions live on COVID-19. We have a couple to get us started. The first one, Dr. John, this is a great one. Can someone get coronavirus again if they've already been infected?
And I get this question a lot, and the answer is we're not entirely sure, but we don't think so. So the coronavirus, there have been some other coronaviruses in the past. SARS, the Middle Eastern Respiratory Syndrome, MERS, and coronaviruses that just kind of give us cold symptoms. And from those and what we know about this one, it doesn't seem like you can get reinfected. You get some kind of protection. We don't know how long it lasts. Some people are saying maybe a year, maybe longer. People have probably heard about somebody who got sick, they tested positive, then they tested negative, and then they tested positive again.
Yeah, what's
saying,
going on
did
with
they
that?
get reinfected? Experts think that's mostly an issue with the test because this test is so new, they're still working out the wrinkles in that. They don't think it has to do with them getting it, getting rid of it, and then getting it again. So it doesn't look like that happens.
That's a good one. We talk a lot about masks. People, I think, have gotten the message that really, unless you're a frontline healthcare worker, you don't need that N95 mask, and the surgical masks only go so far. They're not really going to be protective unless you're sick and you're trying not to spread your germs. What about gloves?
And you've talked about this, how the mask, you cannot find it anywhere.
Oh, yeah.
The mask, the hand sanitizer, all that is completely gone. Is that nationwide?
It seems to be that way. We're getting reports. When I did a Costco run maybe 2 weeks ago, people were already taking pictures from coast to coast of store shelves that were empty of various supplies. This weekend, I happened to be out shopping for just regular hand soap, went to a Target, a Duane Reade, and a CVS.
Nothing.
All of them were not only out of the hand sanitizers and the wipes, but out of a lot of liquid hand soap as well.
Yeah, so a lot of people are making a run on these things, but the masks you're talking about, people are getting those too, and they're not just getting them from the stores, they're actually taking them from hospitals, especially from intensive care unit. There was an intensive care unit in Denver where they said, sending out warnings, say, hey, don't take these, we need this because healthcare workers need it. That rectangular one, that's called a surgical mask, and it's a paper mask. That was made so surgeons didn't cough or sneeze onto a patient. So it's made so things don't go out, not so much so things don't come in. And it's not going to protect you from the viruses because it doesn't have small enough holes to protect you from that. The other one, the N93 or the N99, which is a different one, they're the circular ones. Those might give you a little more protection, but that means they have to be fitted properly. And in medical school and in hospital settings that I've been in, they fit them. They're sized, they fit them, they test them to make sure they fit appropriately, and then they keep changing them out every now and then because you don't want to wear them constantly. So will they give you some protection? Maybe. Do you need them? A lot of recommendations are not to use them in public.
Don't panic if you don't have your hands on a mask. The gloves idea, though, I think is interesting because a lot of people want to know, if I'm going to the gym, should I wear gloves? If I'm out in public touching door handles and things like that, should I wear these surgical gloves? Is that going to offer some layer of protection, or is that a false sense of security?
I think it's a false sense of security, and number one, you don't get the virus through your skin, and so that's not going to go through your skin. So if you touch the virus with the glove or with your hands, it's going to do the same thing if you touch your face. And a lot of people have that false sense of security because they have gloves on and they do things and then they touch their face and they get it that way. On top of that, at some point they're going to have to take the gloves off. When they take them off, we're specifically trained in how to take the gloves off so we don't touch any of the outside. If you touch the outside, you're just getting that virus right on your skin. So again, the main thing to do is not worry so much about the gloves, just worry about keeping your hands clean, and that mostly means washing them.
That is still the gold standard. Soap and water, washing for 20 seconds, doing the WHO. There's a great video online by the World Health Organization about how to properly wash your hands, really to get into the fingernails and that kind of thing. I think we really want to stress that point, right? That if you can't get your hands on a mask or if you can't get your hands on gloves, don't worry. You don't need those things. You're going to be fine. Dr. John, you just said if the virus is on your hands, it can't go through your skin. Unless you touch your mouth or your nose or your eyes, you could literally be covered in coronavirus on your hands and not get it, right? And not get sick.
And you're going to be completely fine. And the other thing is, a lot of people are into hand sanitizer right now and getting that, and we talked about the lack of it out there. The hand sanitizer, if you think about it, we haven't had hand sanitizer except for the last maybe 10 years or so.
I love that point that you made. It just kind of like snapped us all back into reality. Don't panic that you can't get this thing that's sold out. It like causes you to have that FOMO and like, I need this thing. No.
Yeah, we haven't had it for, and soap and water does a much better job. And what the recommendations are is you should wash your hands with soap and water. If you can't get to a sink, then use the hand sanitizer until you can get to a sink. And so the sink is the ultimate thing.
We do have some questions coming in? Oh, okay, lots. Sorry.
So one of the big ones is that Is it possible for the virus to travel on clothing? And if so, is there any knowledge of how long it may linger?
Basically, the clothes is the same as a hard surface, right?
And the question was, can the virus travel on clothing? And if it does, do we know how long it might last on that? We're still figuring out more information about the coronavirus. We think on surfaces it doesn't last that long, as in maybe minutes or a few hours. On clothing, it could last a little bit longer. And so if somebody is sick in your house, the recommendation is, number one, they're quarantined. But number two, you wash their clothes separately, you take care of everything separately to make sure it doesn't cross-contaminate. But people talk about ordering from Amazon, ordering from China. The virus doesn't last that long.
Right.
And so if you order something through Amazon, you get it the next day. If you order something through China, you get it a few days later. It's not going to have coronavirus on it.
And odds are it was probably shipped from a container to a warehouse here and then shipped to you. So it's been a long time. I read the CDC says, is it possible to spread the coronavirus from a surface and then to you? It's possible, but still the most likely mode of transmission, is that 6 feet.
By far.
So when you're within 6 feet of someone, as we are right now, any coughing or sneezing, that's where the respiratory droplets are going to be able to carry the virus.
That's why all the recommendations to cover up when you cough and sneeze, just to protect everybody.
Into the elbow. And I'm seeing more people do that, actually, which is great. But you're saying that if you do get the virus here, it could be on the clothing.
It could theoretically be on your clothing if you get the virus, if you do have the contamination there.
Okay.
So just be a little careful.
This one's good from Olivia. She says, I heard that coronavirus is not affecting kids as badly. Are we seeing the same respiratory symptoms as in adults, or are they symptoms different?
Great question.
So the question is, does coronavirus affect kids? It doesn't seem to affect them as badly. This is from Olivia. And do they have the same symptoms as adults? Well, what we know from China, where they had those tens of thousands of cases, of all the cases of coronavirus, less than 3% were in children. And of the children that got them, which to begin with is a very limited number, 98% of them had just mild to moderate symptoms. And so not an issue for children at this point because they seem to have some kind of protection. And I think that's either because their immune system can really adapt, it's more rapid than ours, or because they get all these other viruses throughout their life up until they're 5 or 10 years old, and it kind of protects them a little bit.
I also read there were no deaths in children under 10.
It looks like there's been no deaths in children under 10. It's one of those, the reports are not completed yet, but it looks like at this point no deaths in under 10. There have been a few teenagers, but the more important thing is, especially in the teenagers that had it, their symptoms are exactly like adult symptoms. Fevers, cough, and then the big thing is that shortness of breath. That's when it starts going downhill. That's
a sign that you should probably call your healthcare provider. Don't automatically go in, call, tell them what you're experiencing and where you've been, and then they'll advise you from there.
And the reason you don't go in is because you don't want to get everybody sick in the waiting room. And if somebody's in the waiting room and you're sick anyway, you don't want to get a secondary infection.
One other question about kids that I saw earlier is people were asking if my child has asthma or any sort of underlying health condition, should they travel?
So asthma, any kind of respiratory issue is going to put you at a higher risk, not necessarily from getting the virus, but from having complications because of the virus. But like we said, the children seem to have that little bit of protection anyway. And so if they have asthma, it's stable, probably not a big deal, but at the same time, like the government's warning, you want to avoid large crowds, you want to avoid these long trips on the airplane, especially international type trips, if somebody has underlying disease to begin with, especially lung issues.
Okay, especially if you're in the elderly group and possibly if you have children with underlying conditions. Okay, good.
And so a lot of people are asking, if I'm immune compromised, what can I do besides the washing of the hands and hand sanitizer?
So the big question is, if I'm immune compromised, what can I do besides hand washing and hand sanitizer? Number one, that's the most important thing you can do, is washing your hands. Number two, the second best thing you can do is avoiding areas where you might actually get the infection. That means large crowds, any kind of travel. The government has actually come up with recommendations about cruise ships in particular.
Yeah, Dr. Fauci just yesterday on Meet the Press with Chuck Todd essentially said, if you're elderly with an underlying health condition, avoid going on a cruise. It was really strongly worded.
Right, and what they're also saying is avoid any kind of crowds, avoid air travel, especially longer trips. And so you just need to take a little bit care of yourself, a little bit better care of yourself than you normally do, but not much different than you would do in a regular flu season. I want to emphasize that.
I agree.
Yeah, the flu season is here. It's still bad. It's still causing issues and a lot more deaths and illnesses than this, but this is a newer virus. That's why people are very concerned about it. But at the same time, it's the same type of precautions.
One big upside, I'd say, to this virus is it's making us all aware of the habits that we should have for cold and flu season anyway. That vigorous hand washing, that coughing into our elbows, just being aware
Staying
of our
home
surroundings.
if you're sick.
Absolutely, because people usually push the envelope. I don't think anyone's going to go into work if they're sick now because they have a reason beyond the normal cough and cold season.
Well, I think, and from what I've seen in different environments, including ours, if you're sick, other people are going to be like, hey, get out of here.
Giving you the hairy eyeball,
I do
absolutely.
not want you here because they don't want to get it.
some questions here regarding the process. If you start seeing the symptoms, what should you do? Because you're not supposed to just show up at the ER or the doctor's office.
Yeah, that's super important. If you think you have the symptoms, let's go over that. What should you do, and what are the symptoms to look for before you call?
So if you think you have the symptoms, what you should do, number one, is look at your own history. Have you been somewhere where there's coronavirus? Have you been exposed to somebody who has coronavirus? Or is it possible you have and might not even really know it, but is it possible you're in that area? If you do, the best thing you can do is call your doctor. If you don't have a doctor, call the emergency room and say, hey, I think I might have this, here's why, and they'll walk you through it. Most importantly, what they'll say is, tell us when you're coming here so we can meet you, because we want to put a mask on you. This is no different than if you remember back in the swine flu epidemic we had
H1N1
in 2009.
flu.
Same thing. They said, hey, don't just show up here, but come here, let us know you're coming here so we can put a mask on you to protect everybody else. Same thing here. They don't want you to just walk in, because then the whole doctor's office is possibly infected, so they want to be careful.
And by the end of that, 60 million people were sick with H1N1.
Right.
Other questions?
So another one we're getting is about food preparation and what to do for that, because they're talking about salad and then heating up food. How do they get rid of the virus if they think it's on food?
So number one, the virus is not a foodborne illness,
right.
And so it's not. You don't have to worry about it like you do salmonella or E. coli,
Listeria. It's not like that
Shigella
at all.
or any of those. But at the same time, if somebody who's preparing the food has issues, you need to concentrate on them, and that means making sure that they cover. Number one, if they have coronavirus, they shouldn't be preparing your food. If they're coughing or sneezing, make sure they cover up, wash their hands a lot before they prepare the food. So it's not a foodborne illness. It's not something that's going to go through our food system like these other ones do.
Right. But
something to be careful of, especially if you get if you go out and about to eat.
And if I may take a moment to talk a little bit about some of the misconceptions that may be going around about Asian food and Chinatown and Chinese
Definitely.
restaurants. Some people have been asking, can you get it from food? Dr. John Torres just said, and this is the advice everywhere, it is not a foodborne illness. However, the CDC says there is some evidence that coronavirus can be found in fecal matter. But that goes with any kind of situation of sanitary food preparation. If someone has fecal matter on their hands and then is preparing food, you could get some sort of disease from that. But coronavirus cannot infect you from food.
And if you've eaten at a restaurant, especially an Asian restaurant, 6 months ago and you were fine and you trust a restaurant and you had no problems with it, then it's still okay. It's still
exactly.
good to go.
They probably need your support now more than ever.
Yeah, definitely.
So another one is, what is the big difference between a cold and the coronavirus?
So the big difference between a cold and
Cold,
coronavirus is a couple things. To get down in the science just a little bit, there's a couple viruses that cause a cold. One of them is called a rhinovirus. That's the one that most likely causes it. But there's also 4 coronaviruses that cause cold or cold-like symptoms. The big difference is what happens with that, and what does our body do with it, and how far do the symptoms go. With the cold, we've all been there.
Right.
You get sniffles, you get runny nose.
Typically not a fever.
You sneeze. You usually don't get a fever. If you do, it's a very low-grade fever, and by that I mean hovering right around 100, and then you recover from it over a few days. The coronavirus, most of the people, that's 80% of the people, are going to have similar symptoms, and so they might not even know it. Or they might be a little more moderate than that, but they're going to have those mild to moderate symptoms. It's going to be like a cold. It's when it starts getting into respiratory issues. That's the big difference between a cold and
like you said, the
and
shortness of
coronavirus.
breath is a key.
Shortness of breath is the biggest key right here. So, again, things to remember. And I think we have time for maybe 1 or 2 more questions. So.
Brenda wants to know, and I think you touched on this morning, will the virus go away as the weather gets warmer?
This is a good one.
This is a great one, and the answer is we don't know. Looking at past coronaviruses, they are seasonal. They basically go away when warm weather happens for a couple reasons. One of it is the virus we think might act a little differently in warm weather, so it doesn't pass as much. But the other one is, think of our habits in warm weather. We're not inside as much, so we're not
outside,
congregated.
We're further apart.
People don't have runny noses as much, so they're not constantly wiping their face and touching door handles and things like that. And the virus, again, might act a little bit different. Caveat being, we're not sure about this one because it is
new.
If you remember its original name, it was novel coronavirus, which means we didn't really know because it's so new. They're hoping it does, and that's what everybody, I think, is sitting here crossing their fingers, silently hoping it happens, but we can't rely on that.
It's so important, especially if you're planning something for the summer we don't know yet, and it's important to monitor and keep on the news.
Okay, let's get one more question.
This is for self-quarantining that I've seen. People are saying, I feel better after 6 days. Why do I need to stay quarantined for 14 days?
So actually, they just came out with a study, which is pretty interesting. We're going to talk about this on Nightly News tonight as well with Lester Holt. In the study, they found out that most people start getting symptoms within 5 days of being infected. So that incubation period, we say, is 14 days.
Right.
And that 14 days, as we say, you need to quarantine for 14 days because that's, up until that point, you could still develop the disease. study found out that most people get it at 5 days,
Okay.
but almost everybody gets it at 12 days.
Oh, okay.
And so it gives you a couple days leeway of making sure they get it before you go out in public. And there's been more than one person that has gone out, broken that quarantine, that 14-day period, and infected other people.
And that's leading to that community spread.
Exactly, and that's the community spread, and that's the breaking of containment that we keep talking about. And it's extremely important if you are put on a quarantine, especially if it's a self-quarantine, and they say 14 days, that you take that very, very seriously.
And abide by that, because you could stop with you, and containment is really the key right now.
Right, exactly. And we all need to do our share, our part, to make sure that it doesn't do much more than it's doing right now, that it doesn't extend much more than it's extending. But
one quick question I have, immune system. People were asking about that. How do you boost your immune system, and will that help?
So the app, basically, you can boost your immune system a little bit, and that's staying as healthy as you can, and that means eating right, exercising. It's still a great time to exercise.
Yep.
And you know, looking at the regular, if you think about the diets that your mom always talked about, eating more fruits, eating more vegetables, that kind of thing, that's what's going to boost your immune system. I know a lot of people want supplements,
Right.
they want vitamins and things like that. Maybe a little bit in some areas, depending on what they are, but overall, it's just eating that healthy diet, exercising, keeping your stress low, because that can actually suppress your immune system.
And getting rest.
And getting lots and lots of
Something
rest.
you and I need to do a better
Exactly.
job of.
And the big thing, too, a caveat here is that the ones that have been most affected by coronavirus are smokers. And so if you can
it's time
quit
to quit,
smoking,
yeah.
now is a great time to try and do that. Great.
All right. Well, thank you so much, everyone, for your fantastic questions, and we'll continue covering this as it develops. So please keep it here on NBC News.